All right. Hi, everyone. It's Andrea from AndreaTooley.com, and I'm here again for a video part 2 with Dr. Shannon Tosounian, who is a first-year medicine resident at Einstein in Philadelphia. And if you haven't seen our first video all about the difference between being a DO or an MD and everything you need to know about being a DO, then you should definitely check it out because Dr. Tosounian is a wealth of information. But I wanted to make this second video with her because, like I said in the first video, Shannon and I originally connected on Instagram, and I am like such a fangirl, and I have a girl crush on her because she's like a yoga extraordinaire. She always cooks these amazing, healthy, beautiful recipes, and she's just such an inspiration to not only like medical students and residents, but basically everyone who wants to live well, and she just embodies wellness, and I know she's so passionate about it. So, Shannon, I'm really excited to have you here to kind of talk about your philosophy and life and living well in all different capacities. So, thank you.
Oh, thank you. I'm so excited to talk about it. So I'm happy to be here again.
Okay. So before we kind of like dive into everything wellness and health related, can you just give us like a little update on residency, your first year medicine resident? Like, how's it going? What's it like? What's your life like now?
Yeah. So I'm halfway through intern year, which is crazy to think about.
Congrats.
But thank you. It's been an amazing year so far. Not without its challenges, but I'm super happy to be where I'm at and just so happy to be doing medicine. I'm a huge nerd and just love going to work every day and learning more. The hours are obviously difficult. My program is awesome. We never, exceed the hour cap, but some weeks are long, and I'm very tired, and I'm making sleep a priority, but I'm just loving it so far.
That's fantastic. So what kind of stuff do you do as just a medicine intern?
You mean at work?
Yeah.
Yeah. So every month I'm on a different rotation, and my program is set up to be 4 weeks of inpatient medicine and 1 week outpatient medicine, which I think is awesome because outpatient is fantastic, and it's also a nice little respite, every fifth week to just take a breather, going to work at 9 o'clock rather than 6:30.
Yeah.
But as an inpatient medicine resident, I see all my patients in the morning. It can range from anywhere from 4 patients up to even 10 patients on very busy days, usually somewhere in the middle, around 6 to 7. I see all my patients in the morning. I write my notes on them. I present them on rounds, and then I take good care of them all day. I follow up on any consults that we put in. I see them later in the afternoon to make sure everyone's feeling well, and just move them along the course of the hospital so that if they came into the hospital, they feel a lot better once they leave. That's kind of the idea always. Also, as an intern, we have intern morning report on Wednesdays for our didactics, and then we also have lunchtime lectures every single day. So on top of taking care of my patients, I don't want to sacrifice my education. I really try to make it a priority to always go to noontime lectures, and so I do that pretty much every day at lunchtime as well. So that's my typical week.
That's so great. I mean, it sounds really similar to what I did last year, and it's a lot, and it's overwhelming, but it's wonderful.
Right, yeah. I'm glad you did a medicine residency.
Yeah, I really was happy to do I did a prelim medicine year instead of a transitional year, which can be a little more electives, and I was really happy to get a lot of medicine and feel like I at least got as much learning as I could, because now it's scary to think like I only got 1 year of this and there's so much like I need to know for my patients. So
yeah, I'm sure you did amazingly.
Oh, thanks. Yeah, a lot to learn. And then so perfect, kind of just a little update about what life is like as a resident. And then so can you just tell us about your kind of like philosophy in life, and how did you get involved in this healthy living stuff? And I'll make sure to post your Instagram, and like you have a Tumblr that people can see so that they can follow you, because you're so inspirational, and I just love your whole philosophy. But maybe tell everybody else.
Yeah. So I have always been extremely active since I was very young. But I didn't understand what that meant and why it was so important until undergrad. I got very heavily involved with a research team whom I adore. I'm still very close friends with them. And we did intervention studies on young obese males for various cardiometabolic risk factors and how it affected their overall health. And I think at that time I saw, how important this was in such a young population, that I just started to develop along the way how I could incorporate this into my life and basically practice what I wanted to eventually preach to all of my patients. How can I live every day a little bit better, a little bit more mindful, while also not going crazy and taking it to the extreme, while having that very beautiful balance of living well and being good to the world, while at the same time still having fun. So that's kind of the overall approach I had, was just going through life and just happiness as a priority, and being as healthy and mindful as possible. Yeah. And along the way, I learned a lot. I'm always reading about, different foods and different ways to meditate, and, just different ways to improve yourself with just what you have in your house, for example. Not having to go on crazy expensive retreats and not having to buy really expensive products or anything like that, but just what can I do in my home and in my community to eat well, to exercise well, and to feel good. And in hopes that feeling well, I can radiate that to everyone else and inspire everyone else to live well, to live to their best ability with what they have. So that's kind of how I got started. And I started using social media as a means to connect with like-minded people like you, Andrea. And it was just a lot of fun. I had done yoga before, but I found all these inspirational, amazing people doing yoga on Instagram as well, and started practicing at home and really getting into, what can I do, yoga-wise? How can I, better my practice and make it my own and make it athletic and make it fun? Yeah. So I started incorporating more yoga as well. And then from there, I just started, connecting with more and more people and changing, how I live every day and how I can adjust it to my schedule that is so busy, and just living happily every day, I guess you could say.
And that's a huge challenge, what you just said, living in such a busy lifestyle. And I feel like that's what everybody says, especially residents. I feel like every resident that I know, it's like, well, I don't have time to cook. I don't have time to do anything. Like, you just can't. And that kind of goes, you can carry that into any field, any professional field, where in business people are working hard, or in law school people are working, everything. If you're a teacher, you're working hard no matter what. And so this whole, our lifestyle doesn't necessarily set us up to make healthy choices. And that's just the nature of our culture. And so how do you combat that?
Yeah. That's a good question. So the biggest mistake I used to make was not making sleep a priority. Mm-hmm. And I would try to study more or exercise more and not make sleep, the number one thing that I should focus on. Yeah. But I'd say the number one thing that helped change that and helped me feel my absolute best was always making that the thing that I strive to do is to get enough sleep. And when you get enough sleep, everything else falls into place. Even if you don't think you have enough time to sleep as much as you want to, when you do, you're more efficient. You know how to use your time more wisely. You go through your day alert and aware and just better, And so that when you come home after a long day, you had actually slept 8 hours the night before, so that if you come home at 6:30, you're more inclined to cook a nice healthy dinner, which doesn't take really that long, and then get in a quick workout. It doesn't have to be an hour and a half full-blown, sweat until you die type thing, but just a moderate amount of exercise, and you perpetuate that cycle of feeling great every day if you make sleep a priority. I know schedules are busy, and I think you have to also no matter what you're doing, if you're doing medicine or law or whatever your career is, or if you're a stay-at-home mom, you have to forgive yourself for not being perfect. If you have set out to, cook every day for your family and exercise 5 times a week, and with the schedule that happens and whatever, you only do it 3 times a week. If you beat yourself up about it, you're not going to go back to that. It's going to be a negative connotation to living well.
Right.
So you just have to let it go, forgive yourself, and realize that, all those things are important, of getting exercise in and eating well, but that's just one part of living a beautiful, healthy life. The rest is connecting with the people you love. And as I mentioned earlier, that I'll say over and over again, getting enough sleep. So I think it's just, constant forgiveness and getting enough rest that helps perpetuate the lifestyle.
Okay. I love that. Oh, I love all of that. That's so great. Okay. And then you also come at this from a really unique perspective in that you've done research on nutrition and fitness, and you are an athlete yourself, you cook yourself. So I feel like you have a really great perspective on all of this and so I'd love to know like what kind of advice you give patients or you give your peers about like what kind of workouts to do and what kind of things you should eat and what should we all know?
Absolutely. Okay. So in a nutshell, it's very personalized, but there are a few things that I tell my patients that are pretty general that I think apply to everyone.
Yeah.
So, I work in northern Philadelphia. Mm-hmm. It's a pretty socioeconomically depressed area. Mm-hmm. So, there's huge barriers to healthy lifestyle. So what I like to at least say to my patients, and I think this applies to everyone, is to take baby steps. You're not going to be able to change your lifestyle overnight. Mm-hmm. So we start with very small increments. And this has been awesome in the clinic. For my clinic patients that I fortunately get to see every 5 weeks, we take baby steps with these types of things. And the first thing that I always tell people is, if you want to prevent, lifestyle-related diseases, preventive diseases, as far as diet, you should, like, sugary drinks, completely out, okay? And that's a very concrete idea that my patients can understand, that we can all understand. Yeah. They're not going to make you feel better. They're not going to make you feel full. They're, they're pretty much a waste of money. Mm-hmm. So we start with a baby step saying, let's cut out all that garbage and just drink water and plain coffee. Mm-hmm. And it's a very easy concept that my patients like, that they can go home as a goal and try to achieve by the next time I see them. And then from there, instead of approaching it with a cutting out method, saying like no brownies, no cookies, no pizza, none of all the good things that we love, I focus more on the concept that a few other physicians have used is the crowding out method, which I think which I really love.
Good stuff.
Yeah. So, that I focus on saying like, okay, so you want to go to the grocery store and you want to, let's focus, you don't eat any vegetables right now, say. Mm-hmm. Let's try to eat 2 servings of fruit and 2 servings of vegetable every day. Mm-hmm. Don't worry about cutting anything else out. Just incorporate those things into your diet. Right. See how you feel. See how full and satisfied you'll feel, and how you'll not want to reach for that junk food if you're feeling good with all these micronutrients and lots of fiber. You're going to feel so much better and not want to reach for all the cookies and candy later. Mm-hmm. So that's the basic approaches that I take that I think can apply to everyone. And then from there, it's obviously going to be more specific to the needs or the caloric content or whatever. But those 2 concepts, I think, help a lot early on in trying to change your lifestyle and maintain it. Mm-hmm. And as far as exercise, same concept. I start slow and try to work up to what people are capable of. But it's a similar idea in that, it has to be easy and it has to be something you enjoy. I would never ask someone to buy a gym membership and go and lift weights if that's something that they have no interest in. Right. So it has to be something simple and that you enjoy. So if it's ballroom dancing or taking a walk, whatever it is, whatever you can maintain and not be, oh my God, I don't want to do this. Like, if you can convince yourself to do it, then that's what we start with.
That's great. And you feel like when you connect with these patients and you see them back in 5 weeks, do you feel like you get some success with them, or are you reaching them?
Yeah, it's hit or miss. I think that they are inspired, and they don't feel overwhelmed to make these changes. I would say that not everyone's going to follow it, and it's not going to be something. And I think also it has to do with maybe they're not ready to make those changes. But once they are, it can be something that can be easily incorporated. Yeah.
But when you see somebody who's made a change or who feels better, that's got to feel so good to you.
Oh my gosh.
Yeah.
It's honestly amazing. I'm just thinking of one patient in particular who was, came in really, really sick, very, very poorly controlled diabetes. I mean, just borderline could be hospitalized any minute for how bad his diabetes was. And we sat and talked for as long as I could about simple things he could change. And, I don't know if all, the people watching this video are familiar with hemoglobin A1C, but it's a number that indicates how well your diabetes are controlled. And he went from a 14 to a 7 within 3 months. Yeah. And, he was on insulin, but we didn't change his insulin regimen. He was just compliant with it and changed a lot of things about his life. And he was so proud of himself that, it honestly made me want to cry. It was just so exciting. And, applying all these lifestyle changes, they're taxing to do to a whole population. But when you're a clinician and you're in the office and you're applying it to an individual who feels that satisfaction and feels so good, it makes it all worth it. It really does. So, yeah.
That's fantastic. And then what are your kind of long-term career goals? How do you think that you want to incorporate this passion? And I ask because I think that a lot of us, definitely I feel this way. I have this interest and this passion for wellness, but it's hard to find exactly how to incorporate that into my career. And and I know that you will. What are your plans?
Yeah. So, I am hoping that. So I personally want to do GI. That's actually the fellowship that I'm interested in for a number of reasons. On top of being very interested in lifestyle modification, I'm a procedural type person. I like them. And GI, physiology, pathology, I just love it. It's just fascinating to me. And I think a huge part of that is it's so nutrition based, and also back to my osteopathic philosophy is the GI system is connected to everything. It's so incorporated even to our psyche. How, what we do with our gut actually affects our brain. So I'm getting really interested in how microbiota affects our psyche, how happy we are, just crazy things like that. I just love it. So I am going to pursue a career in GI, I think. But I'm also very interested in healthcare economics, lifestyle prevention for reducing healthcare costs. So I think with every subspecialist, there's a role for preventive conversations with your patient. Maybe they aren't specifically, exercise and diet related, but there's a role for preventive medicine in every field. Like for you, I'm sure it's regular eye exams, especially for the diabetic or for, anything like that. And if you have a niche for being interested in diet and exercise, I think it would be, and I'm sure you do this, but reading as much as you can how lifestyle modifications affect, ocular physiology and how those changes not only help them prevent diseases like the big ones, CAD and diabetes and everything, but how's it going to affect their eye health? Constantly having those short conversations. If they hear it from you, then hear it from me, then hear it from their physical therapist. Eventually we're going to perpetuate this movement of, hey, this is really important. Maybe I should make these small changes and maybe I'll feel better because my ophthalmologist is telling me along with my primary care doctor and everybody else. So that's how, I approach. I think that there's this idea like, oh, I'm a specialist, I don't have to talk about these things, which I think is unfair, And I think we all have a role in promoting this, patient involvement in their care. So I hope to incorporate that as a gastroenterologist. And for me, it's a little more relevant because, I'm going into a career with, where nutrition plays such an integral role in our pathophysiology. But I think it's there for everyone, no matter what specialty.
Oh, I love that. And you're so right that you can't say I'm a subspecialist, so I don't need to talk about these things. Because, well, first of all, that we all went into medicine because we all want to care for the entire body. And even if you're subspecialized, you can't remove yourself from that. And what a burden then you're placing on the primary care if you're saying, well, that's their job to talk about that. You just,
exactly.
You can't.
Yeah, exactly. And, going back to, having, forgiving yourself and having, it's okay if you can't change the world in a day. I know, like for you as in the clinic in the ophthalmology, you probably don't have a ton of time to sit down.
Right.
So instead of taking the approach of, I need to have this 20-minute conversation about eye health and how, diet affects it, but just small incremental, conversations that you can start incorporating. I think that would be for any specialty. It could be started.
Definitely.
Yeah.
That's such a good philosophy.
Yeah.
Okay, and then, so, that's amazing, and I hope that all the medical students and residents watching kind of take that and perpetuate that into their career. And so, besides doing those kinds of things on a patient care level, I have lots of people ask questions about, like, how do you stay healthy as a resident or as a medical student or a college student? What kinds of tips do you give your peers, and what do you do personally to stay healthy in such a rigorous training academic environment?
Yeah. So, my idea is that, I did this in medical school, and it worked so well, and I've told a lot of other medical students to do this as well, is that, I, not strictly, but I had this idea that every day for 1 hour would be for self-care. I can't be my best if I don't take care of myself. And that goes across the board. And so what I did with that, that hour was really dependent on what I needed that day. Usually, to be honest, it was for exercise. I love to sweat. I feel so good when I give myself that opportunity to put the books aside and just go out for a run or to do a yoga class, whatever it is. And when you make it a daily part of your schedule, then it's just already locked in. You don't have to think about it. You say, from 7 to 8 p.m. tonight, that's my time. I'm going to go work out. That's already there. I don't have to worry about it. And sometimes that would be a little bit more time for me to cook healthier meals, but whatever it is, I put it in my schedule and I made it, my time to take care of myself.
Yeah.
And that really, really worked in medical school. I never had a problem with that. Even on some of my busier rotations, I still felt that I could take care of myself if I put it into my schedule. In residency, it's been a little bit more difficult, but still maintainable. On our call days, I obviously don't have an hour to really dedicate to self-care because I'm sleeping and then going to work and then coming home. And it's the same idea of forgiveness. There are going to be long days. But on those busy days, when we think about it, we're so active, we're so involved, and, we're moving around so much that not getting a workout in, or even the next day, you're on your feet all the time, which is how we as humans were meant to be constantly moving. Having a structured exercise plan where you go 5 to 6 times a week, you don't need that if you're so active. If you really are that busy, it's not needed. It's not needed for health. Maybe there's aesthetic reasons, you want to get that workout in, whatever. But if we're talking purely health, just let it go. You don't need that. So that's been a big help for me. And like everything, to maintain it during a busy schedule, keep it simple. I'd say that what I cook and what I've, my recipes and everything, they've been really, really basic this year. And it hasn't been, as fun. I haven't been able to incorporate like arrowroot extract into a recipe, but I still feel really good, very simple salads or, roasted potatoes with eggs and, some sort of vegetable. Takes, you put it all in a pan, you put it in the oven, done, and just keeping it as simple as possible. And just always reminding yourself, like, I am going to feel so much better and be happier if I eat well throughout the day. It's really easy to reach for junk, and sometimes I do because it's there and it's delicious. But for the most part, I know that I'm going to feel better if I eat well. And back to what I talked about earlier, I never, ever, ever sacrifice sleep.
Wow.
I go home, I sleep as early as I can,
Yeah.
and then it perpetuates feeling good all day.
Yeah.
Yeah.
That's great advice. I mean, we should all strive to do those things as students and residents, because it's easy to put yourself last and just try to get through everything, and then your self-care goes out the window.
Right. And another thing that I would add to that is, even on top of all that busy schedule, you have to care for those around you too. I'm married. My husband is amazing. He's a complete doll, super supportive in everything I do. So I make sure that I'm not, not giving him the attention and care he needs, because he's a huge part of my life and my happiness, and that we have to continue to encourage each other and be there for each other.
Yeah.
And as well as friends, in residency, giving them the attention outside of the hospital.
Yeah, you have to have that support network and people to talk to. And
yeah, definitely. Yeah. Depression is a huge topic in residency right now. I think there was a statistic recently saying that, greater than 50% of residents in the U.S. have considered themselves depressed or are currently depressed.
Wow.
Which I think is so unfortunate. I understand where it comes from. It's a very taxing system. It's a very depressing work that we do sometimes. But I think, keeping your head, having a separation of work and, personal life is so important to encourage better psychiatric health as well as a resident.
Yeah. That's a really good topic, too, to touch on, that people don't think about enough or talk about enough, and it's so true.
Yeah.
And really important to consider that.
Definitely.
Any other, like, healthy things, or, like, things that you've gotten from your Instagram or your involvement with, like, you have all these, like, movements that you're with and awesome things that you're doing?
I'm trying to think of other things that are really important as far as that. I guess I just, when it comes to social media, I really like to promote movements that are creating awareness. Things like, breast cancer awareness, all those things. And I take all of those opportunities for it not just to be about, oh, breast cancer exists,
Right.
But I take it as an opportunity to educate, as far as mammogram screening and how obesity is related to the risk of breast cancer. Small changes that, where we can say, how does preventive medicine affect this disease that is getting a lot of awareness, but what are we missing? And I think a part of that is education about how the patient can, again, involve themselves in the prevention. So little things like that, I think, are really important, with these movements and with these awarenesses, especially as, healthcare providers, that we take the opportunity to educate.
Definitely.
And so that's kind of how I try to use social media in that regard.
Yeah.
Yeah.
And that's fantastic. It's really great. And I think people love it, and they, they get to know you on a more personal level, but I feel like that gives you an even bigger voice to say these things or plant little seeds in people's minds when they know you from a social media perspective. They get a little insight into your life, but then it gives you this credibility with people. They relate to what you're saying, or they believe what you're saying. I think it's a really cool way to reach people in a different sense. I don't know if any of that made sense.
No, it does. It absolutely does. Yeah. And I would say the same for you. I think that, people know you on a personal level, and when you have a certain topic in medicine or just in lifestyle in general, you have some credibility because you believe in it, So it's a similar idea for you. Yeah. Yeah.
Great. Well, thank you so much, Shannon. You're just such an inspiration, and you're amazing, and I'm so excited for your career. And when you're a famous GI doctor or whatever you choose, I'll say I knew you or know you.
Same. Thank you so much for having me. This was awesome. It's been really fun to talk about. And as I said in the last video, if anyone wants to email me about, lifestyle in general or lifestyle in medicine, anything, please email me.
Yes. I think people will love to hear from you, and I'll post all your social media links when I post the YouTube video so that everyone knows.
Thank you.
Okay, well, thanks everyone for watching. Don't forget to subscribe to this channel so you never miss a video. And thank you so much, Shannon, and we'll talk to everybody later. Bye!